Hallo, Dumelang, Sanbonani, Goeiemorgen. Yes, it's still Goeiemorgen. Thank you guys so much for joining and for being part of this conversation. I think it's an important one to have. As you know, I tested positive for COVID-19. I am so proud and grateful to be able to say I'm today on day 18, which means, you know, I've finished my isolation, my quarantine, but I'm still taking it easy. I'm still staying home for at least a couple of more days. And I just felt, you know, it was important for me to use my platform to, I guess, answer questions that I felt that I had during the, you know, the process. And hopefully, you know, you'll be empowered and you'll learn something and you'll take something from it and, you know that COVID-19 is beatable. Yes, it is. Obviously, there are people who have lost their lives, sadly. But we are definitely able to manage it from home if you don't have, you know, underlying conditions. So thank you so much for joining. Dumelang, Dumelang. I'm seeing all the hearts, Pastor P. Yeah, some of the handles we're taking, they don't have the names, so I can't even. I see you, Kosi. Thank you so much for joining. I want to give a special shout out to Dr. Lydia Masimola, who was my doctor and helped me walk this journey and helped me navigate COVID, you know, just from home, being able to pick up the phone and call her, ask questions. You know, she, you know, when I was nervous, when I was panicking, she was there to guide me through this. So I'm very, very grateful. Thank you, Dr. Masimola. And then, as you know, a couple of weeks, I think it's about a week ago, I shared a video that I got from a very good friend of mine. So when my husband tested positive for COVID-19, my good friend, Pastor Pushy, sent me a video. And it was a video by Dr. Sandhya Ramanathan. And it really just talked about managing COVID at home. And that video really helped me to relax and take it easy and guide me through being able to navigate COVID-19, being home. And I am very proud to have been able to reach out and grateful to have been able to reach out to Dr. Sandhya and have a brief chat with her, you know, telephonically. I mean, we've been back and forth for the past week. And she agreed to join us. So I am looking forward to having this conversation with Dr. Sandhya. Let's check if she's on. We're going to go right into it because I know that it is like 8:30 p.m. in New Zealand because she's based in New Zealand. And then I just want to mention before I invite Dr. Sandhya on that there were a lot of questions that came through about things that we covered in my previous live chat with Dr. Marlon. And I would encourage you, if we don't get to your answers, there's a lot of questions about COVID and kids, about pregnancy, about childbirth, about testing, and a lot of things that we may not cover in this conversation. You will be able to find the answers. I've posted it on my timeline, so if you want to just go back and watch that, I encourage you to do that if we don't get to answer all your questions. Today, we're focusing on managing COVID-19 at home. Oh, there she is. Let me invite Sandhya. Okay. Hi, Doc. How are you?
Good, Gail. How are you?
I am very well, thank you. Thank you so much for joining us.
Oh, it's my absolute pleasure.
Yes, I know that it's like 8:30 in New Zealand. Thank you for making time. We appreciate it.
That's okay. It's just starting to party time.
Awesome. I'm just moving my thing a bit back because I'm a bit cut off. Okay, there we go. All right. So, Doc, I would like for us to probably immediately go into this conversation because there's so much to cover.
Sure.
And I don't want to waste time. An hour goes by so quickly. We've obviously... Yes. Okay, great. We can hear you clearly. The connection is great. So we can
Wonderful.
get going. I got a ton of questions and I've made notes here. That's why I keep looking down. I've made a couple of notes. And I watched your video and it helped me tremendously. I forwarded it on to tons of people and I've posted it on my social media, and I thought it was a great opportunity for us to perhaps just have this conversation. And, you know, as you know, probably that our cases, we are about to reach our peak in South Africa. So I think being able to equip us with knowledge on how we can manage this from home, especially if you don't have underlying conditions. I think it's important to be able to have that conversation and put this knowledge in our hands so that we can manage this from home.
I think that's an excellent point to start this whole discussion. And I think we connected on the phone, and I think we're soul sisters because we both exact same vision. And I talked to you about my 2020 vision for COVID-19 pandemic. And I saw that there were a few questions and there's a lot of fear. There's a lot of anxiety. But I truly believe that the way to navigate this COVID-19 pandemic is with the right mindset. And the right mindset is replacing ignorance and fear with knowledge and determination. Because when you know, when you're ignorant and you know nothing about the virus and you're just, chasing shadows, you're fighting an invisible enemy, you feel very afraid, understandably. But we actually know quite a lot about this virus. And today I just really wanted the whole spin of this talk. We'll try and cover as many questions as possible, and I'll answer it to the best of my ability. But I just want to, my whole point is that prevention is far better than cure.
Yes.
And that's sort of the basis of my video as well. Because believe it or not, being in New Zealand, I haven't actually, had to actually treat many COVID-19 patients. But obviously I have family overseas and I have treated patients, and, I've been doing a lot of reading since the beginning of the pandemic, and, and obviously a lot of people are getting better. This plan that I made, which you followed and a lot of people are following, it's basically common sense, most of it. And it's the basic principles of fighting any viral infection. So it's not just relevant to COVID-19, it's relevant to any viral infection. And if you follow these steps, and that answers one question, because people are like, oh, but how do I know I've got COVID-19? There's real issue with access to testing. I would say that in the age of COVID-19, any viral symptoms, whether it's a cold, like a runny nose, a sore throat, scratchy throat, with or without fever, cough, whether it's dry, whether it's moist, everything is COVID until proven otherwise. In fact,
yes.
Yeah, even if you don't have symptoms, you've got to behave like you've got it.
Wow.
Because you might tomorrow, or you may be an asymptomatic person. And that is a very, very important concept for people to understand, that you have to, for the duration of this pandemic, we have to behave as if I've got it, everybody else has got it. So everything we're doing is to protect me, it's to protect you, it's to protect it's to protect all of us. Okay, so that's a very, very important thing. And so that's why my video or the steps are, it's not like I can only do this if I get COVID.
Yes.
No. It's
that's actually
viral infection.
Yes, that's actually very interesting that you mentioned that, because one of the first questions that I had for you was obviously what to do and managing yourself and your family before you even test positive or you encounter symptoms. What do we need to do? What can we do to prevent it? And I think that's where I'd like for us to start our conversation. So you haven't tested positive. What do you do?
Okay, so all families just normally trying to navigate this pandemic. There's some very important things for every single member of that family to understand. And that's what are the weaknesses that we can, knowledge that we can basically use about the virus. And the very first one is that it's an RNA virus. It's a tiny little virus. But the point of weakness is its outer layer, which is fatty. Okay? So in order to destroy this virus, you need to wash your hands for 20 seconds. In New Zealand, I'm not sure what they say in South Africa, but in New Zealand we were told we have to sing happy birthday twice. Yeah. Which is actually quite hard to do if you're not actually visualizing. I like to say, imagine that there's your hands covered by millions of tiny droplets of oil.
Oh, wow.
Okay. So if you're just washing your hands, singing happy birthday, going la la la, this is very boring, I don't want to do it. But actually, if you're thinking, oh my God, my hands are covered in oil, and these viruses are actually oil particles on my hand, you're just going to be scrubbing, and you're going, oh, I don't want to put oil on, you know, my nice top, or I don't want to put oil. You're going to wash. And I would say, think amen a lot. Amen means avoid your mouth, your eyes, and your nose.
I like that.
And namaste, amen. Whenever you meet anybody, no, you know, shaking hands or whatever, but yeah, avoid. All the time, like since the beginning of this pandemic, I have something just constantly going in my head. Like you have to be in a hypervigilant state. It's almost like you can visualize that the virus is around.
The virus is everywhere.
So that's why even in my video I mentioned about masks, that another layer of protection is glasses, because basically, so the first point is that the virus, you know, if you wash your hands well for 20 seconds with soap and water, if you don't have soap and water, then you can use alcohol gel, like a sanitizing gel with over 60% concentration of alcohol, destroy the virus on your hands, particularly before you're going to touch your eyes, your nose, or your mouth. Okay? So it's not like every 2 seconds I'm going to be washing my hands, you know, especially when I'm sitting at the house. But definitely before you go to eat or you go to touch your face or anything like that.
Wow. Okay? That's very empowering.
The other one is that this infection only transmits from one person to another person via their respiratory droplet. So that's the whole point of social distancing. Because, you know, the greater the distance, the further you know, if it's at least 2 meters, then if that person coughs or sneezes or even shouts, that respiratory
or talks or sings,
it's going to hopefully fall before that 2 meters. Now, the whole new factor of which, you know, I would say don't give this virus the benefit of any doubt. You know, it's proven that we shouldn't give it the benefit of the doubt. So it's pretty obvious that it's airborne, that it can stay in the air for up to 3 hours. So, yeah, I mean, you know, the authorities will take their time coming out. I would say just act as if it is. So again, that's another purpose for, you know, wearing masks, which is very important, you know, when you can't socially distance in particular, is because, you know, that will not only protect the other person if you're infected, it'll protect you. The best protection is if we're both wearing it. And also, if you are interacting and somebody happens to be infected, whatever virus particles are coming out of their mouth, it will reduce the viral load by 20 to 30% of what you're going to get. And that's a concept I discuss in the video, which is very important. It's this reduction in viral load. So that's why basically washing hands, keeping distance, wearing a mask, and wearing it properly, mind you. So, you know, that is it's essential, because the mask should protect you, not infect you, okay? So the mask the masks preferably are a cotton breathable fabric. They should be at least 3 layers. You know, I got somebody to make this one up for me, and I got her to put in a little pocket, so I can add in a little, you know, paper towel or a tissue, because that, you know, then you can change that, and it's not, I mean,
that's very clever,
people are pretty nifty. So before you put on the mask, your hands must be clean. Then, and a cloth mask is fine. It goes over your nose and your mouth, okay? And when you're out and about, and you know, your hair should be tied back. If you're, you know, I mean, you're lucky you don't have to tie your hair back. But I would, if I was out, I would actually even, you know, cover my hair with a little scarf if I could, if it's quite prevalent, like it is in South Africa, you know. And when you're out and about, no fiddling with the mask, okay? No fiddling with it at all. You don't take it off to cough or sneeze. You
don't pull it down. You don't
pull it down, because basically the outside of the mask and the rest is all covered in COVID. You're covered in COVID. So when you take it off, when you get home, wash your hands well, then remove it from the ear loops and pull it off like that. Okay? And then the cloth one will go straight into the wash. And I would hot wash it, and I would dry it very well so it's ready. So, you know, you could have a few. If you do use a surgical mask, just these are disposable, only one use. It has a top side and a bottom side. The top side and the blue side is the outside, because it's got a sort of a waterproof membrane, and the wire is at the top because it will mold to your nose. So again, the same thing. Okay. So you take it off and you throw it. You don't wear it every day.
And don't wear it under your chin. Don't pull it down your nose. Don't, you know, because then it defeats the purpose. And then you're putting basically whatever is on there, COVID,
and then you
pull it back up. Yes.
And then
yes.
Infect yourself.
Yes, I actually posted one of your pictures from yesterday. I posted it yesterday on my stories. But I want to move on because we've literally, you know, time moves by so quickly. Is there anything else that you want to add on prevention before we move on?
So the other really good concept I wanted to share with you is one that we were taught in New Zealand, is that our house and our family is in a COVID-free bubble. Okay? So that means that when we come back from outside, we are going to decontaminate carefully, and we're going to try and imagine that inside our house there's no COVID. So that means, you know, whatever clothes you're wearing, you know, you'll take them off near the door, you know, maybe have a little garage or whatever, you know, keep those clothes for going out, or, you know, hot wash them if they need to be washed. Your shoes need to remain outside because COVID can come on your shoes. I have a little spray bottle made up with, you know, diluted methylated spirits, 75%. I've got a video on that on YouTube and Insta as well. And, you know, you just spray those, or you know, disinfect any groceries or anything. And, you know, wash your hands thoroughly and try not to bring COVID inside the house.
So basically, when you get home, you need to take off what you're wearing before you go into the house and change.
Yeah. Wow. Well, yeah, I mean, this is what we were doing doctors were doing since the beginning of the pandemic. Another very useful thing, especially if you're in a highly prevalent area, is that you can do a betadine mouth rinse, or even a saline mouth rinse as soon as you get in. And that same that I showed, that little nasal dropper that you make up with betadine, put it in your nose, because again, if you're assuming that you may have some in your upper respiratory tract,
you may have contracted it.
So you're just trying to rinse it out. And this is what doctors have been doing when they come from work, to try and reduce their chances. So everybody can do it. It's a simple thing to do. So that's so you can imagine that's your bubble. Now, the same thing with this same concept I'm going to say. If somebody is infected at home, suddenly you've got to think, there's COVID inside the house, okay?
Wow.
It's airborne. It's inside. Now, do you know, because I've seen a lot of questions of this, how, if one member of the family is doing this inside your house, what are you going to do? What's the best way to prevent it going to all the other family members?
Run, you know, get the family out. And I'm laughing at, actually, someone said, oh my goodness, so I have to leave my clothes at the door and be naked. No, that's not what we mean.
No,
but, you know, that's funny. But obviously, yes.
No, I mean, I keep, for example, my jacket, or what I'm wearing out, and I would say
on the outer layer.
The outer layer, you know, just keep it on, you know, and then I just keep it in the garage or by the door. And I would say the same for the kids' school uniform. Just keep it, you know, take it off and try and, you're not going to absolutely get rid of it, but you're trying to reduce that viral load, basically.
Yes.
So the best way, basically, is to isolate that person in their own room and try to minimize. Now, I saw that some people said, you know, you might not have a separate room, but just create a separate space. You know, put, you know, a tape around that area or partitions, and just try and keep them away. And masks, again, are very important when there's somebody that has it. And if you can imagine those particles are inside the house, you would want to open the windows and ventilate whenever you can. Absolutely. And those particles are settling on surfaces. Now, particles don't survive for long times on surfaces. They reduce in concentration over time. But obviously, if you've got somebody in the house with coronavirus, you are going to be cleaning all the common surfaces quite frequently. And bathroom is very important. One very important tip I want to bring up about bathrooms is that, if possible, the person who's infected should have their own bathroom. But, and, you know, because you can get some shedding in the motions, that, you know, close the lid when you flush the toilet so you don't aerosolize that as well.
Wow.
Yeah. And also, I mean, these are practical things that families need to know.
Yes.
And, you know, the bathroom should be cleaned very frequently, disinfected, especially if you're sharing bathrooms. And I would say, you know, wait a little while, you know, ventilate it before going in after, you know, the person.
That is very useful information, because I remember when my husband tested positive, so he tested positive first. And I was obviously the one, you know, we decided that he would then isolate in a room at home, so he didn't go into an isolation facility. But I would, from time to time, well, a couple of times a day, bring him something to eat, or bring him something to drink, or whatever. And you actually don't realize that maybe, you know, because we're in the middle of winter in South Africa, maybe the room wasn't sufficiently ventilated, you know, and then obviously also it was probably advisable for me to leave his food at the door and for him to take it, as opposed to me having to go into the room. And I went in a couple of times, you know, and then I got COVID. So there are ways of preventing it, preventing yourself from getting it if there is someone who lives in the house. So literally you have to minimize to the best of your ability your contact. You can't get emotional like, oh, let me just take the tray in, or let me just, you have to leave it at the door. And you know,
I had a great analogy for this. You have to think that that person who's infected, they're in a fight with COVID-19, like in a boxing ring, okay? They're in the center, they're fighting COVID-19. The rest of the family is on the outside of the ring, okay? You are still providing the support, but from a distance. You are still cheering them on. You are still attending to whatever they need, but from that distance of that boxing ring, whatever.
That's incredible.
Okay, so
that's actually an incredible analogy.
You know, I mean, you're there. You're like, you are going to take stuff with you know, your tray. You're going to leave it by the door. Obviously, if they need help, you can take it in, but you are going to be wearing your mask, you know, gloves, and you know. And another thing I thought, even because of South Africa with heating, you can even think, you know, it would be preferable to have, say, something like an oil heater as opposed to a heat pump, which is going to be driving the air, especially if the windows are closed. That would be a nice way. And that is actually also another good thing. Keeping the room warm is good for your breathing, and, you know, because it's that dry, cold air, which often makes things like cough and breathing pain worse. So if you've got a more moist, warm, you know, or increase the humidity even with a humidifier, that will help the person with their recovery.
Yes, sure. That's very informative, because I think from just the questions that I got in my inbox, a lot of the times people are saying, I tested positive, how do I keep my kids and my family safe? Or my husband tested positive, how do we stay safe? So I think,
just on the kids, because I saw a few questions about that too. And now I understand that it's quite difficult, you know, to separate the mother and the child, especially if the child is sick. But if the child is over the age of 2 and the caregiver has to interact, then you can, you know, while the child is being supervised, have a mask on the child and a mask on the, you know, and keep it to one family member who's designated to looking after the child. You know, again, masks will provide a big defense there. Again, the ventilation, again, the hand washing and all those things that are happening. So it is possible. And I think you really have to think about this concept of viral load, because it's, you know, you're trying to minimize it. And it does happen. I mean, you know, you can get just one person infected in the family and the rest manage to get away with it. I've seen questions where they're like, oh, it's all over Red Rover. I mean, somebody's got it. We've all got it. No, you have to, the minute you get any viral symptoms, you must isolate that family member away from the rest of the family, and you all must stay home.
Yeah.
And get good.
Yes. And I think, you know, for me, obviously, a lot of the questions come through about parenting and having kids. And my experience has been that kids don't struggle much with it. I mean, their symptoms are relatively, my kids at least, their symptoms they didn't have any symptoms. But there's also the reality that not everybody's going to manage it the same. So you also don't want to be...
Were your children tested?
My children are 2 and 5.
But were they tested for COVID?
No, they weren't.
Yeah, but they had no symptoms.
No, they had no symptoms. And obviously, before I tested, I had quite a lot of contact with them because I didn't know. And the concept that you're explaining now is actually scary, because I'm thinking of going into that room, bringing the food, and not being, and basically being exposed And I think another important thing to mention is when you go into the room and you are treating somebody, for them to have their mask on. You know, you have a mask on, they must still keep their mask on, preferably also keep their distance, you know, and just because it's your husband, I think or your mom or your sister, sometimes we do let our guard down and think, oh, but it's my sister, or it's my child, or it's my daughter, you know, and then you let your guard down and you forget that, like the concept that you explained about all these things floating around.
Yes, and that's exactly it. It's a reframing of thoughts. This is not an act of fear. This is an act of love. The distancing is love, because you don't want to infect your loved ones. It's very difficult for people to think, you know, even newborn babies, they're saying they shouldn't, you know, because the risks are, there's so much unknown, you know, especially with the children, that even newborn babies, everybody except the mother, you know, the parents should keep their distance of at least 2 meters. The grandparents, people shouldn't be kissing them. Another point with if the breastfeeding mother is infected, there was a question about that. I think it's very important. It is important still, you can continue to breastfeed your child. Again, use masks for yourself, obviously, not the baby. Make sure that you wash your hands carefully before feeding. You don't kiss the baby. You try not to touch the baby's face. If you are taking medications that may interfere with breastfeeding, although unlikely, paracetamol or Panadol doesn't generally interact. But should you be taking any medications, take it away from the time you're breastfeeding. You can express the breast milk, and even if you can't feed for a few days, you can always, you know, restart the breastfeeding by expressing and, you know, letting the milk away. And, you know, using formula in between, and having that backup option is very important. Another quick thing just about, I talked about positioning, and somebody asked a question about prone positioning on a pregnant woman. I just wanted to show that this would be a really useful cushion to have at home. Yes. One, because obviously for a pregnant woman, if they're infected, to sleep on their front, and the prone positioning is very, very important, so that, you know, your lungs are, you know, at the back. Okay, that's where the doctor listens for your lungs. You listen at the back, and so we don't want those air spaces compressed. Okay, so it is very important. I think Dr. McKay said 16 hours a day. I would just say that you spend as much time when you are resting that it's on the front. People have asked about lying on the side. Even on the side, your side lung will get compressed. And one of the first places which the pneumonia would show, or the collapse, was the right lung base. So if anything, I would very much avoid sleeping on your right, and as much as possible, you know, sleep on your front. Another very important thing is keep your body moving. So, sorry, getting back to the immunity and how we can, the very, very important thing about prevention is that your immune system is your #1 defense mechanism. So for that, you need to eat and sleep well. Okay, so eating means real food, fresh vegetables and fruit. In fact, your plate, this is a healthy eating plate, should actually be half salad vegetables, only your palm size of carbohydrate and your palm size of protein. Okay.
Yes. And I want to touch on that, Doc, because I think it's important when we go into now chatting about now getting infected and the importance of vitamins and supplements to strengthen your immune system. I know in the video you mentioned priming your immune system. I want to touch on that, and then I want to, you know, also maybe for you to just help guide us, because not everyone can afford multivitamins. Not everyone has access to be able to buy vitamins, which are, you know, relatively costly. And what then superfoods or supplements with food can we then take to help strengthen and boost our immune system?
Okay, so the components of immunity were eating well, sleeping well, 7 to 9 hours, moving and loving more. So moving more means exercise, and that can, you know, be done in the house, yoga, cardio, and stressing less is very, very important. So staying calm is like the most important, because when you are stressed, basically you're in that fight and flight mode, and it's very bad for your immunity. You want to reserve all your fighting spirit for the infection, for that boxing ring time.
Yes.
Now, in terms of the immune boosting supplements, and I would say you need to work on this right now, is vitamin D is extremely, extremely important, particularly in any of us that are living in countries, you know, that are in winter, and those that have dark skin. because vitamin D, you know, it takes longer in darker skin, and that's why there's been a preponderance of, you know, bad outcomes in people with those backgrounds. You know, Asians, you know, Africans, Middle Eastern people, and a lot of, and that's why vitamin D, it's you know, it's definitely proven. Now, in terms of vitamin D, everybody's fixated on, I mean, basically you shouldn't go into this infection being low in vitamin D.
Yes.
So it's freely available online. I mean, I would say in terms of, it's hard for a doctor to get up and give a script for everybody, but it's important even for children and, you know, breastfeeding mothers. You should not be deficient. I would say, you know, something for adults and, you know, children over the age of 12 are pretty much similar to adults. I mean, I, you know, got one from just the chemist, and it was like 1,000 international units of vitamin D. I mean, for an adult, you could take one every day or second day.
Yes.
Make sure you've got a good level. In terms of foods that have vitamin D, there's not actually many foods which, and the other thing is, it's there's D2 or D3, preferable to get vitamin D3, okay? Okay. That's easier to absorb. In terms of foods, it's mainly in fish and things like that, very hard to consume. There are, I'm not sure if this is the case in South Africa, but some of the milks are supplemented with vitamin D, and the juice, not that, you know, drinking juice is a good idea, but some of the cereals have supplementation of vitamin D. Egg yolk contains vitamin D. So you can very easily search up vitamin D. The guidelines are there.
Yes.
It's not impossible to get it from food sources, but it is quite difficult. So, and sitting out in the sun, because it also, because by the way, if you wear sunscreen, you're not going to absorb the UVB to make the vitamin D.
Wow, that's very interesting. And very interesting how for us as well, who have dark skin and have melanin, that's very difficult to absorb vitamin D from the sun. So you end up, you know, burning.
Already deficient. So we don't want to be deficient. So as part of that immune, getting it ready, I would say your vitamin D, everybody must be on vitamin D.
Okay.
Or, you know, if they can get a test, that's fantastic. But, you know, I mean, often you don't test it. It's not going to cause harm. The only thing is, out of all those vitamins, vitamin D is the only one that's a fat-soluble vitamin that's going to stay in your body. The rest of them, like zinc and vitamin C, are water-soluble. So you're not going to be able to really overdose on them because they're going to be excreted in the urine.
Yes. Okay. All right. Because I think the conversation that we had when we spoke about how much do I take is just make sure you're not deficient. And whatever your body doesn't need, the body will release. So a lot of people are fixated on how often, how much. Just take, you know, if you, whatever you can get.
And definitely at the first sign of illness, you know, no matter what it is, even pre-COVID, I would always tell my patients, you know, take some vitamin C, take some zinc. The thing with zinc is that basically it's shown to, well, they're still, you know, doing studies on it, but it has been used in treatment regimens because it basically inhibits the replication of RNA viruses.
Oh, I see.
So that's why zinc is important. Again, you know, something like 50 milligrams of elemental zinc. Again, you'll find it in they're not going to sell in the pharmacy.
Something that you can overdose on, absolutely.
The children's one, follow the children's. And after the age of 2, most of them you can get some gummy form.
Yes.
You know, so just use your common sense. Don't get fixated and panic about things. Something is better than nothing.
Yes.
Definitely 3 need to be taken. The first sign of illness, vitamin D, zinc, and vitamin C. And I would say something like 500 milligrams of vitamin C twice a day. I mean, for myself, my family, I like this little, you know, vitamin C, zinc, and echinacea in a chewing form. And, you know, like, I don't take it every day, but if I get a cold at the first sign, I'll take it twice a day. And that's what it says on the, you know what I mean? So,
yes.
Again, it's an
just equip yourself. Yeah, equip yourself with knowledge and yeah.
And if you want to take turmeric, take turmeric. If you want to drink ginger, have ginger. It's not going to cause harm.
Yes. Yes, I had a lot of ginger tea, honey, turmeric, lemons, and, you know, and that brings me to the importance of, let's talk about the symptoms. We've got 25 minutes left,
Okay.
because this is going to cut us off. Let's talk about symptoms and just, you know, the video that you shared and what we can do. So there's the fatigue, there's the breathing, there's, you know, drinking hot beverages versus drinking cold beverages. There's shortness of breath, there's sore throat. How can we treat those symptoms?
Okay, so I just want to then take it back to those steps that I went through. So first was the immune priming, which we've been through. The next was the reduction in viral load, which is, so a lot of those upper tract symptoms, you know, so the minute you start feeling symptoms, it's your indicator that I've got, virus particles, and I just need to try and reduce the load and dilute it. So I'm going to do gargling twice a day, with warm, salty water. If you've got something like betadine, I mean, here you can get betadine in either a ready diluted or a concentrate.
We also have it here.
Betadine I use. It was a betadine sore throat gargle concentrate. But if you can't find it, it doesn't matter. You could even use a dental antiseptic rinse. It's okay. But saline, warm saline will do the trick. The other thing is the nose rinsing is very important, or the nasal spray. The other thing which I didn't mention in the video is the importance of nasal decongestants. That's because when you get a running nose, it drips forward, it also drips back. And that's what causes the scratchy throat. And if you dry up the nose, you can prevent that infection from going down into the lungs. So I highly recommend to my patients something like an Otrivin nasal spray. And in a junior form that you can also use after the age of 2. And, you can use a couple of sprays up to 3 times a day. There are other nasal decongestants here. There's something called phenylephrine. Again, these things are good. Again, the steam inhalation is very good.
That helps me a lot. Yeah,
if you've got problems with sense of smell, or even if you've got painful breathing, again, it's the warmth and the humidity. I mean, if you really wanted to and you were having, you could even blow your bubbles in the cup. Again, blowing.
That helped me. That really helped me.
No, because it does. And there's science behind it. Basically, as I explained, that the lungs, you've got your air spaces. The ones that are prone to collapse are down at the bottom, right at the back, at the base, okay? And this is what we're trying to prevent. It's I can't stress the importance of this enough. So alongside reducing the viral, because the virus only binds initially to the receptors, the ACE2 receptors, which are basically lining your nose, your throat, and also on the insides of these little sacs. Okay? So what the virus is trying to do is it's trying to attack, it's replicating in here, and this is where it causes havoc. So first of all, we want to get our immune system and all that, nasal rinsing and gargling to try and reduce the viral load and try and basically halt the virus replication up here before it goes down here. Same way, even if any particles have got down here, what we're trying to do is we're pushing it out. And the only way you can push it out is by first emptying, like I said, breathing all the way out. Breathing all the way out first. Focus on the exhale. Empty out all that carbon dioxide. Hold it. Refill. The inhale is going to be reflex, okay? And you're going to get as much oxygen. Just imagine it was all the water going into that sponge is filled with oxygen, okay? What blowing the balloon is going to do, it's going to simulate what a ventilator does. Because what it's going to do is it's going to create a positive pressure at the end of the expiration. And what that will do is will keep that airway open. And so that's also another very good thing when you're having breathing pain. Is try and, because a lot of that breathing pain is because of the physiological changes that are happening here. Obviously take paracetamol or pain relief, but if you can't physically blow a balloon, which takes a lot of effort, pretend you're blowing a balloon, because when you're sick you need an incentive. Let's face it, you don't have energy.
No, especially not with COVID.
No, I mean, illness, you don't feel like it. You just want to roll over and go to sleep. But the point of the video is it's an active management plan. It's not, I'm sick and I'm just going to go to bed and 5 days later I'm going to be better. No, I want you to fight it.
And I think what has been important for me, even when I was going through it with your video and the support of, you know, a doctor that was helping me treat it, was the importance of preventing it getting, like you say, into the lungs, or preventing yourself from needing, you know, oxygen, or even needing a ventilator. And what I learned is that, you know, the breathing is important because of the shortness of breath. For me, what I found in my personal experience was, I had the oximeter. I have the pulse oximeter that you suggest to get. Yes. So I got that, and it really helped me, because I would check it and I'd be like 92% on my oxygen, and I'll do the exercises and immediately it will go up to like 97, 98%. And I think what that also does is it calms you down, because it makes you understand that you don't need to rush to the hospital. You know, the pulse oximeter keeps you really calm, because you can see, okay, I've got enough oxygen. Now let me do my exercises, and then the oxygen levels increase. So I don't need to panic and rush to the hospital.
Absolutely. I mean, if you can get one, it is just so good, especially when there's difficulty accessing any hospital care. I mean, how are you to know? Because of this whole thing of what they called happy hypoxia, because the pathology in this disease is different to what usually happens. So because it's microclotting, what doctors, you know, when they realized that patients were coming in, they were still talking on their phones, but when they checked, their oxygen saturation was like in the 70s or 80s. And they were like, how is this possible? And then, of course, you know, because once that, you know, you've already almost missed the boat, is what I'm saying. But you may not, it's a silent hypoxia often. But, I mean, you can't always rely on one thing, you know. The other thing is, make sure you do it properly. You can't have nail polish on your nails. Your nail can't be long, okay? You can use anything, because it's through light. It's this little light shining, okay? And it has to go all the way in. I know, because my cousin called me saying her saturation was 84 and I had a shock, and she was totally healthy and she had no infection. I was like, wow, check the machine.
Yeah, the machine, just I see there's a couple of questions. I got it from Dischem and I paid 500 Rand, 499 for it, but there may be different versions in different brands. So that's just where I got mine from.
I mean, I know they say that the actual machine is better than, you know, some phone models have a SAPS probe. And although, you know, they may not be quite as accurate, it's still better than nothing. I mean, most phones, you can also get a free app that you download that checks your pulse. Because again, it's a light that shines in your finger on the lens of your camera. So, I mean, you can actually monitor your temperature if you've got a thermometer at home, and I would say that's very important. But the fever, you don't necessarily have to have a fever. And the fever is often quite low grade. I mean, we classify fever usually clinically is 38.5 degrees and above. A lot of these fevers are, you know, around like 38 degrees, which is not even that high. Yeah,
my husband had a very high fever. He had like 40 degrees, 40.5.
Oh, wow.
And so he then had to take, you know, Panado to help with that. And then he took some Med-Lemon. And I want to just quickly, we've got 15 minutes left, because a lot of the questions that came through were very particular. So for fever, you take Panado, or, you know, similar.
Yeah, and preferably ibuprofen, because there was some talk, you know, initially about ibuprofen maybe causing problems. So I would, and then they reversed it. But I would say avoid it. If you've got coronavirus, stick to paracetamol. It's also a much safer medication in children. It also can cause damage to your stomach, so stick to paracetamol. It's a good, safe medication, and make sure you have the dosages, correct dose for your children as well. You know, and you know that, and that's available. So that's very important.
Okay. And then I want to touch then on sore throats. And you mentioned, you know, the gargling with salt water, that helps. It helped me. I never got the sore throat, but when my husband tested positive, I started doing it just in case. So I never got the sore throat. He did, and I added the betadine.
Doing it. If somebody in the family's got it, every family member definitely needs to be gargling.
Yes, absolutely. And then there is, you know, the tight chest. The tight chest, for me, what I found that the steaming helped. And also I would then add like eucalyptus drops, or you mentioned Vicks, I think, in the video, just to give it that menthol sort of fragrance. And even though I couldn't taste or smell, I could feel it a little bit through my eyes, and that helped. The steam inhalation really helped. And then also for the breathing, you spoke about the blowing of the balloon, the blowing into a straw, just to help, you know, your lungs get rid of what it needs to get rid of. Exactly. Then there's fatigue, Doc. I mean, a lot of people are also extremely tired. I was extremely tired.
But that's the virus. I mean, you're not going to be running around. All those things, fever. Fever is a sign of a good immune system fighting the infection. So the way your body fights infection is it raises its temperature, making it an unfavorable environment for the bug. Okay?
Right.
The only reason we treat that with paracetamol or, you know, is because it makes you feel like crap. Okay? And in children, you know, between the age of 1 and 5 in susceptible children, you know, if you have a rapid rise in fever, you can get things like febrile convulsions. So that's why, you know, and the child is crying and, you feel terrible. But that fever is a sign that your body is fighting infection.
Yes.
If you are tired, listen to your body and rest.
Yes.
But I would still say don't be completely just bedridden.
Yeah. Yes.
Move your body. Like, you know, yoga is great because you could do it gently, even something like the child's pose where you're, you know, leaning down and just doing breathing. It's a beautiful pose. Again, you are essentially prone on your stomach and you can let your lungs expand, breathe, do steam, move, because again, you know, there is this talk about clotting. You don't want, I mean, anybody staying in bed for prolonged periods of time can get, you know, clots in their legs and things like that. You just want to keep your body moving gently. Things like magnesium, that's a simple medication. That's a simple vitamin which helps ease muscle tension and can help reduce sort of stress, anxiety, and help you, you know, go off to sleep. Routine is very important.
Yes, that, and you know, we can go on forever with this conversation, and there are so many questions that are coming through, but I think we have touched on them before, and a lot of them, I think a lot of the questions that we have, especially when you're facing COVID, are very self-explanatory. You know, I see some questions that, you know, someone asking how much Vicks do I put in, how long is a piece of string, you know. I think
just common sense. And I would say, Gail, I have created, because I have been collecting information since the beginning, mainly on Facebook, I have created a public Facebook page under Dr. Sandhya Ramanathan. You can find, if you follow, what I have put is a lot of resources that basically helped me make that plan, but also things to do, like look at when they're infected. Like I've put links of, you know, YouTube videos of other people that explains how to treat your family member and isolate, practical tips, other breathing exercises. And so there's a lot of resources and information. Arm yourself with as much information. Same on my Instagram. I try and share because the knowledge keeps changing. And the other thing about keeping positive is if you keep preventing, it means that the more time we've got already in that 6 months, as I explained, we've come, you know, light years in terms of learning about this disease. And, you know, today there was a great announcement that there's been really positive you know, signs from 2 of the immunization trials.
Yes.
So good, there will be light at the end of this tunnel.
Yes. I want to
navigate.
Yes. I want to touch quickly, Doc, on just going back to symptoms, is smoking. Being smokers, you know, smoking has been banned in South Africa, and there are a lot of, I saw a comment now about someone who asks, like, should they, you know, stop smoking? How that affects breathing.
And I think that one of the good things that people are going to have to take away from this pandemic, and hopefully it'll be a lasting thing, is that people are actually thinking about their health, and that's a very good thing. Obviously, smoking is bad. I mean, this affects the lungs. I mean, whenever a patient comes in with any problem, if I find out that they're smoking, that they're a smoker, then that's my number one thing. I said, if you want to do one thing for your health, stop smoking, because that affects every system in your body. So that's a no-brainer. You need to stop smoking, and you need to look after your, and I would say again on chronic conditions, there was a lot of questions about people with diabetes, or people might have underlying autoimmune conditions. The best way to or, you know, you've got asthma, the best way to protect yourself is make sure that those underlying conditions remain well treated. Don't ignore them. If you've got other problems, you know, get medical advice, even virtually. I mean, we in New Zealand almost switched overnight to virtual consultation. And really, I would say 90% of the medical problems we can deal with over the phone. You know, or through a virtual consult. So don't be afraid to call your doctor. Don't be afraid to reach out.
To seek help,
please get it at the first sign of illness. Please.
Yeah. Okay. And then I want to, I mean, obviously, just to correct myself, I said smoking has been banned. Smoking hasn't been banned. The sale of cigarettes have been banned. But yes, if you can, stop smoking. So I just want to quickly touch on on panic attacks. I found that, you know, for me, I panicked. And it was weird because before I I started having symptoms and I thought I probably have it. But then a week later I tested, and I tested a week later because I was already isolating and already, you know, home because my husband had it. And I wanted to explore the possibility of attending a funeral, my grandfather's funeral. So I tested, and a week later I got my results, and then I panicked. But then that goes into the breathing and panic attacks and pains in the chest and feeling like there's pressure on your chest. And I find that a lot of people who have contacted me have said that they have experienced panic attack, or they're panicking, or they're having trouble with their breathing, but it is in fact panic attacks. And so how important is the power of the mind?
I would say it's number one.
Yeah.
Now, very important thing I'm going to empower you all with. Anxiety is in your control, okay? Now, there will be no single human on the planet that hasn't experienced, you know, worry, which is anxiety. It's a normal human emotion because of the loss of control of the whole situation and this whole pandemic, okay? So by arming yourself with knowledge, we're going to try and calm yourself down. All the symptoms of a panic attack are caused by shallow breathing, hyperventilation, okay? So I'm going to give you one very simple exercise, and I mentioned that in my video, and I've got I've done a interview which is releasing very soon, and it'll be on my Instagram, where I go through this whole mental resilience in detail, and anxiety and depression, and give you tools for that. And that is the box breathing, okay? Because basically what happens is when you hyperventilate, you change the gas balance.
Yes.
And so what happens is that drop in carbon dioxide in your blood basically causes all the symptoms of anxiety. Okay, that then increases your anxiety, which makes you then hyperventilate. So it's a vicious cycle. So the only circuit breaker is slow breathing. And you need to practice the slow breathing when you're well. So the minute you recognize it, you switch it on. So box breathing is you're imagining that you're drawing a box. Okay. And so basically you breathe into the count of 3. 1, 2, 3. Hold. You draw the line down mentally. 4, 5, 6, hold, you draw the line up. So basically what you're doing, and as you get better, you can extend that. But I usually teach my patients that, and basically what you're doing there is one breathing cycle will take 6 seconds, and there'll be 10 breaths a minute. Your anxiety levels go up when it's probably over 15 breaths a minute. So that's a very, very important thing for you to understand, is that you are in control.
In control, absolutely. Absolutely. And I want to encourage, and I want to encourage everyone, if you want to, you know, learn a little bit more about box breathing, I'm sure there are, you know, if you search it online, you'll be able to find it, just so that we have time to touch on other things. And then I want to touch quickly on the reality that we can get reinfected. Yeah.
Unfortunate. And I think it's very important, because people shouldn't go around with a false sense of security. There is no such thing as an immune passport, and there is no such thing as herd immunity. There's only 2 ways out of this pandemic, and that is that we get a vaccine, or that the virus eventually burns itself out, like I think it did at the time of the Spanish flu back in, you know, 100 years ago. So until that time, I mean, they say basically the test so far that after you've been infected, that the antibodies, and that's if you've seroconverted, not everybody does, is that they may last from 3 weeks to a maximum of 3 months. Again, in medicine, I would say there's very little black and white. There's a lot of gray. So nobody's going to be able to tell you for sure. But the point is that you are going to have to continue doing these same amen, you know, mask wearing, distancing, washing hands, protecting yourself, protecting others, ongoing. Because the other thing is, the other point of working hard on your immune system is that, because, you know, there's a potential sting in the tail of this infection, which we're only learning about, where you may get ongoing symptoms like fatigue. Now, I think, again, go back to your immunity. That's, if you work on that, then, and if you try and make that as strong as possible, like you're entering that boxing ring, you're not going to enter that boxing ring when you're a real sort of at a really weak point. You're going to make yourself really strong, you know. So, you know, you're going to fill your body. You're going to get good sleep before the match. You know, you are going to do all those things. You know, you're going to, all your supporters are there, so you're keeping and keeping in touch meaningfully with your life.
Yes.
For your immunity.
Absolutely.
it can't be a meaningless scrolling through social media. It has to be a meaningful connection. And we're so lucky at this stage of technology that we could just switch to online learning. We can stay connected. Like, so I'm talking to you in South Africa.
Yes, absolutely. Yes, it's amazing. Doc, before we run out of time, I want to chat. There's someone keeps asking about blood types. Do blood type affect you getting COVID and how badly you can get it, or it doesn't at all?
No, I think, again, people are clutching at straws.
Yes.
Even if there, may have been some rumor circulating about some blood type, it was not to do with being positive or negative. And it really is irrelevant because, as I said, there's very little black and white. It's all grey. What is black and white is the rules. Follow them.
Yes. Okay. And then one more question. Disinfecting before, well, we've talked about before and during, after. Now you've tested positive, you've completed your 14 days. How important is it for you to disinfect your home and the areas that you've been using?
Well, you're going to be disinfecting the whole time, so the person who's sick, you're going to be washing. I would say that, the house needs a good air out. Again, just remember that surface transmission is not as significant as the respiratory droplet or the aerosol, because unless you're a place which has absolutely got a lot of COVID, or you've got somebody in the house with COVID and you're touching the surface. And so that's why, again, before you touch your, avoid your mouth, eyes and nose. Okay. Now, even if, for example, you had somebody in that room and they had COVID and they were in there, if you aerate that room for long enough, that any particles there are going to go. They're going to dissipate. Same on the surfaces. You'll give them a good clean up and you can be happy that you can use that. But you yourself are not going to be happy till you give the whole house a good clean.
Very true. Very true. Very true. So, someone asked, is it possible for you to just have one symptom for COVID? Is it possible for you to just have a headache? Is it possible for you to just have
symptoms and have COVID, Gail? So of course you can have one symptom. Yeah, that's the point.
Okay. Wow.
Yeah.
Wow.
Interesting. That's why I said if in doubt, stay at home. Like if you think, don't give this virus the benefit of the doubt. Because what's going to happen? I mean, you can still do everything online. I mean, it's funny. I always tell my patients, because there's a whole shift away from doctors prescribing antibiotics, and it's a very cultural thing. A lot of the Norwegian countries have very low rates of antibiotic prescribing, because culturally, the minute they get sick, they go to sleep and they stay home, they rest. Whereas for some reason everybody thinks, oh, I've got to go back to work and infect everybody else.
Yeah.
If COVID-19 has taught us something, stay home. Keep your germs to yourself, because all of a sudden there's flu around. And that's another point. Very important, especially for children. Make sure they're still getting their immunizations. If you can get a flu vaccine, particularly if you're in the winter, get the flu vaccine, because it's not going to protect you against COVID, but it's going to protect you against getting a co-infection with another infection.
Right.
I just want to talk about children because of this whole thing about this post-inflammatory syndrome, which is quite a bit of a worry. If you have had infection, or your children have had it, or it has been in your house, I would be looking very carefully at my children, on a daily basis, making sure that they've got no rash on their body. Check their fingers. You can get weird, nail blue discolorations on the fingers, like chilblain looking things, cracked red lips, red eyes, joint pains, shortness of breath, child complaining of fast heart rate, fever. As a parent, I would
pay attention. Pay attention.
And get help straight away, because there's no guarantees, and it has happened. So that's
so we're going to get cut off because we've reached an hour. But what I want to encourage everyone to do, there's a lot of questions that are coming through that we have answered earlier in the chat, or we've answered, the doctors answered in the previous live chat that I've done, like pregnancy with COVID, like when to test, like the 14-day period. Please go back and watch these videos. We have answered majority of the questions. This was particularly chatting around managing COVID at home. Doc, thank you so much for your time. We really, really, really appreciate you staying up late and doing this live chat with us.
always very happy to help and raise awareness. And
Yes.
please look me up on Facebook or on look.
On
I've done
Instagram.
a video on
You've
Sandhya.
posted a lot, yes. Dr. Sandhya's posted a lot of videos, and you respond to questions, you know, when you have time. Obviously, you are a doctor, you're busy. But when you have time, you do answer to questions. So if you have any additional ones.
Whatever interviews that I've posted, and I think it's good to ask questions. Arm yourself with knowledge. Share that knowledge, because we can only fight this together.
Yes, absolutely. Thank you for your knowledge, Doc. We appreciate it. We appreciate you. Stay safe and love all the way from South Africa.
Stay healthy, stay safe, and, you know, lots of love from New Zealand.
Thank you. Bye, everyone. Please watch the other live chats.